welcome to the Plain English Public Health Weekly Report. I'm Richard Greenland, and today is May 15th, 2020. To start off the news, we are talking about COVID-19, as we often do. The statistics, as of today, we have about 4.5 million cases worldwide, along with a little over 300,000 deaths. In the United States, there are nearly 1.5 million cases and just over 87,000 deaths. In Wuhan, China, where we think this all started, they believed that they had it under control, but they've recently experienced a little bit of a flare-up in one area of their city. And so now, in hopes to stop it completely, they are going to be having all 11 million citizens of the city take tests, and then they'll work on it from there. Scientists have also found that even just talking, we're not even talking about coughing or sneezing, but even just talking can release enough virus into the air that it's able to stay there for up to 14 minutes in some situations. Now, this is something that we typically don't have to worry too much about as long as we're following the recommendations for social distancing, staying 6 feet apart, and also wearing face masks. As long as we're doing that, this news doesn't really change anything, but for those of us that are not doing that, I'd recommend definitely starting. Some good news with the COVID-19 is that a study has found that nearly everyone that gets COVID-19 develops antibodies for the virus. Now what this means is that because most viruses, if you develop an antibody for that virus, it means that you will not get that virus again. Sometimes there's what's called partial immunity, where you may possibly get it, but it'll be weaker. But for coronavirus, for the COVID-19 coronavirus, we do not yet know for sure that that is the case, that we can develop immunity if we have antibodies. But scientists expect that once the studies are all done, it will be the same as many other viruses, and that we will develop immunity. So seeing that most everyone gets these antibodies is a good thing. Another study suggests that a higher consumption of vitamin D can help protect from the symptoms, the most severe symptoms of the COVID-19 disease. It will not keep you from actually getting COVID-19, but it will help with reducing the symptoms. Again, the research is still ongoing, but many scientists are not surprised that this is the case, because vitamin D has been shown in the past, in other previous studies, to actually provide a boost for the immune system in general. Even better news is that Sorrento, a therapeutics company, has announced some initial testing on a promising antibody that could become a treatment for COVID-19. They haven't done any human tests yet, but the tests in their lab have shown a 100% success rate in stopping the virus from entering the cells. When they can't enter the cells, viruses can't live on their own, and so they just eventually die off. And so this could be a very promising treatment. Again, it's in the early stages of testing, and so we don't know how long it'll be before we get this, but it's just another good thing to hear. In other news, not so nice news, throughout the world, in addition to the COVID-19 pandemic, there have been a lot of other viruses that have become very active. For example, large dengue outbreaks are occurring in South America and Southeast Asia. The Democratic Republic of the Congo is having a flare-up in the Ebola outbreak that began in 2018. Yellow fever is severely affecting Ethiopia right now. Measles is a big problem in Mexico and Burundi. And Saudi Arabia is still fighting the last major coronavirus, Middle East respiratory syndrome, also named MERS. It just hasn't gone away yet. And so they're facing all of this. In other news about COVID, the marriage and couple relationships that we have both good and bad news under the COVID-19 pandemic. Some of the bad news is that because of the stay-at-home orders, a lot of the people that are in relationships with domestic violence or abuse are not able to get away from that situation. They're not able to go to a friend. They're not able to go shopping or whatever. And a lot of times they're just stuck with that abuser. Also, in addition to that, the shelters for victims of abuse, many of those shelters are either not open or they're limiting who they take in for fear of spreading COVID-19. On the other hand, psychologists state that those relationships that are absent of abuse, this pandemic and the accompanying stay-at-home orders will actually help those relationships. The main reason for that is that instead of being able to just run away from any problems, couples will actually have to sit down and talk about it, work through it. They'll have to work together, take care of any kids they may have together. Being together and communicating typically helps a lot in relationships. Moving on to environmental news. Some areas of our planet are getting close to experiencing temperatures too hot for humans to live in. The human body typically has an internal temperature of 36.8 degrees Celsius, which is just over 98 degrees Fahrenheit. And in order to keep our bodies from overheating, the temperature on our skin has to be a little bit lower than the temperature on or inside our bodies in the core. That way it'll allow the heat from our core to migrate out to our extremities, our skin, and be released. If we have a high enough level of heat and humidity in the outside air, it limits that ability. Whenever it gets too hot, you can sweat, and that carries heat from the inside of your body to the outside, and then that sweat evaporates, and that's a cooling mechanism. But with too high of a heat or too high of humidity, that breaks down. And so scientists say that as the world heats up, it's going to become a lot less friendly for us, and there may be a point where it becomes too hot for us to even live. One thing that should help with that is a bit of good news on the environmental side. This year in the United States, for the first time in United States history, if everything keeps going as it has been so far this year, the energy produced by renewable sources of energy such as wind and solar are going to be higher than the energy produced by coal. This is definitely good news, since coal can be more polluting to our environment, and it's not renewable. We're eventually going to run out, though it may be a while. Part of the reason for this is because the pandemic, with stay-at-home orders and large buildings shutting down and having workers work from home, we're just using less electricity overall. Another reason for this is that the renewable energy sources are becoming more efficient and cheaper. They just don't cost as much, and they make better use of what they have. So, ending on that note, I just want to thank you for watching, and get out, get some sunshine, get some vitamin D to help you fight off any COVID symptoms you might have, get that fresh air, but make sure that you're using your face mask, make sure you're doing your social distancing. We can get through this all. Thank you again for watching Plain English Public Health Weekly Report. Again, this is Richard Newland. Please subscribe to our channel. Thank you. Bye-bye.